The discovery of vaccines has played an important role in eradicating several life-threatening communicable diseases. However, recently there have been several outbreaks of vaccine-preventable diseases in North America and Europe. Even though the scientific and medical benefits of vaccines are very well known, vaccine hesitancy is still prevalent due to safety and efficacy concerns. WHO defines vaccine hesitancy as a delay in acceptance or refusal of vaccine despite availability of vaccination services. We can say that vaccine hesitancy has compromised herd immunity, where individuals vaccinated against diseases provide protection for those who are not vaccinated. When herd immunity is compromised, vulnerable populations are at risk.
Due to the success and benefits of vaccination, new generations of Canadians have been made unaware of the risk of vaccine-preventable diseases, and concerns have shifted onto the risk of vaccines themselves. Reasons for vaccine hesitancy are autonomy, lack of knowledge, being misinformed, not understanding the severity of the disease, fear, and religion.
In the past, power over patient care has resided mostly with the physician. However, nowadays, the power has shifted towards patients. Patients are becoming more involved in their own health decisions and express their hesitancy regarding vaccines. Knowledge deficit is also a contributing factor for vaccine hesitancy. This can make the public more vulnerable to be manipulated by anti-vaccinators.
According to the Public Health Agency of Canada, the introduction of vaccine has substantially decreased mortality and morbidity rate of infectious disease. While absolute refusal of all vaccines is rare, hesitancy is observed on a regular basis in most primary care settings. Most Canadian parents choose to administer all vaccines to their children, and childhood immunization rates are usually high across Canada. 70% of parents are concerned about potential adverse effects from vaccines, and 37% believe that a vaccine can cause the same disease it was created to prevent.
Social norms heavily influence vaccine hesitancy and are often established through social networks where people learn and form opinions about vaccination. These social norms can influence one's decisions to delay or refuse vaccination completely. Although social norms can influence vaccine hesitancy, it is also a powerful external factor that can increase vaccine acceptance. People will be more accepting of vaccinations if they take it as a social responsibility to maintain herd immunity. Those who get vaccinated can make it a social norm for others to follow in their footsteps. The challenge in creating a social norm is to make this activity, which is routine and private for individuals, more public. We can consider giving stickers to those who get vaccinated or use social media to promote vaccination.
In Canada, vaccines are regulated by Health Canada and the Food and Drugs Act. Evidence from the manufacturers is required to prove their effectiveness, safety, and quality of the vaccine in order to be authorized by Health Canada. In BC, there are no policies stating that children need to be vaccinated in order to attend school. This has led to a decrease in children being up to date with routine vaccinations.
There are no policies regarding influenza vaccines for healthcare workers, and the rate in Canada is below 50%. There is controversy regarding the violations of their rights and freedoms. Organizations offer employees the choice to vaccinate or wear a mask to respect the law and rights of the person.
Vaccine hesitancy is associated with levels of education and economic status. It was found that the schools with low percentage of vaccination were from both the most affluent and most disadvantaged communities, suggesting that socioeconomic factors are not the only factor determining a vaccination status. In higher income populations, vaccine refusal varies from religious belief to fear of adverse effect, while in low-income population, refusal was linked to issues of access to healthcare services and trust in healthcare providers.
Ethical considerations regarding vaccine hesitancy are balancing the autonomy of parents while maintaining beneficence and non-maleficence by protecting the public. For the pediatric population, ensuring the protection of the child and community through beneficence and non-maleficence are arguably outweighing parental autonomy.
Recommendations from healthcare professionals are significant and strongly affect vaccine acceptance of the public. Nurses are especially important and are essential members of the interdisciplinary team who work with clients to counsel and administer vaccines.
The core concept of nurse as activists is having the power to enact changes by listening to their concerns, empathizing, understanding their values, answering questions, and building rapport, and avoid making assumptions about their beliefs and their hesitancy to vaccinate.
Actions that nurses could take to improve vaccination among children include implementing policies for increased education and services in the community and schools regarding the effectiveness of vaccines, and participating in campaigns that promote the increased fundings for vaccines to ensure the safety and effectiveness of the drug.
Actions that the nurses can take to improve the vaccination rate among healthcare workers include supporting health authorities' policies on vaccination, advocating for the cause, and encouraging fellow coworkers to get vaccinated because it does not only inhibit the spread of the transmissible diseases, but it also protects ones from acquiring disease.
Initially, we thought that the main reason for vaccine hesitancy was lack of education. However, we now realize that there are many other reasons, such as parental autonomy, being misinformed, not understanding the severity of the disease, mistrust in the healthcare system, fear, and religion, and that vaccine hesitancy is not dependent on economic status, as vaccine hesitancy occurs on both the high and low income end of the spectrum.
Vaccination hesitancy not only affects children, but also healthcare workers, which is surprising because it would be assumed that they understand the benefits of vaccination. Recognizing our own assumptions and beliefs allowed us to be more aware of what is actually happening around us in regards to communicable diseases and vaccination.
In order to respect the beliefs of their patients, healthcare workers should be aware of their personal beliefs regarding vaccine hesitancy.
As healthcare workers, it is our responsibility to provide accurate information about vaccinations to our patients so they can make informed choices.
Thank you, and we hope this presentation was informative.